Ready? All right, welcome everyone to the monthly meeting, the October meeting of the Dunn County Health and Human Services Board for October 24th. Let the record show that all of the members of the committee are here with the exception of Mr. Lamb, who is excused, and Supervisor Hagan, who is also excused. I know I did that last month. We have meeting minutes from our September 26th, 2024. Is that a motion?
Yes.
Supervisor Steen moves approval. Is there a second? Dr. Hall moves second. Any additions or corrections to the minutes? Additions or corrections? If not, all in favor of approving the minutes, say aye. Aye. Any opposed? Minutes from September 26th are approved. Taking up all my space with papers. Do we have any public comment? Anything from email?
We do not.
I see what that is. All right, moving ahead. Our next meeting date was actually scheduled for Thanksgiving. And I didn't think anyone would mind if we switched it to the week ahead of Thanksgiving. That would be the 21st of November. Does anybody have any concerns about that? Okay. All right. Well, let's go then with our next meeting of the Health and Human Services Board for November 21st. We've moved this up in the action item number 6. Review of the September DHS vouchers paid. I need a motion to note review of the vouchers. Dr. Hall moves. Is there a second? Supervisor Bashan seconds. Any questions, comments? Yes, Dr. Hall.
So again, I'm just curious, and I'm wondering if maybe at a future meeting we can have a report out on how our foster care expenses have been over time. And maybe it's, I haven't been keeping track, but it seems like it's been a lot. And not that I'm saying we shouldn't be covering those costs, but if they're going up significantly, then maybe that can be a tool to use to say perhaps we need to look at some preventive services or other services that might help keep us getting from the point where we need foster care. I don't know.
Ms. Winder, any comments or concerns, or Becky, any concerns about that?
I can bring up financials specific to that next meeting.
Okay. All right. We have a second. Yes, we do. Yes, we do. We have a second. All right. I need votes to approve to note review of the October vouchers. All in favor?
Aye.
Aye. Any opposed? Vouchers are noted. And review and approval of the 2025 aging plan. Tracy, do you want to talk about this first? We get a motion first. Why don't you start first, and then I'll ask for a motion.
Sure. So just to preface this a little bit, every 3 years, we have to submit a new aging plan to GWAR, which is the agency that the state of Wisconsin contracts with to be our consulting agency related to our aging programs in the ADRC. So this plan is specific to the aging side of the ADRC programs, which are the aging programs include our nutrition program, and as well as some of our caregiver programs, our national family caregiver support program and our Alzheimer's family support program, as well as our evidence-based practice health promotion activities that we do. Bernie Allen is with us virtually. We were able to change his position a bit, so he is now the Aging and Transportation Programs Manager with the ADRC. So thankfully for me, Bernie took the lead on this aging plan for the first time this 3-year cycle, and he has put together a short PowerPoint just to go over the main points of
Perfect.
our proposed aging plan.
Perfect.
So Bernie, if you want to, there he
Thank you,
is. I
Bernie.
see ya. If you want to take it away, just let me know when you want me to forward the PowerPoint slide, Bernie.
Okay, sounds good. Thanks, Tracy. Can everyone hear me okay?
Yes, yes, go ahead, please. And thanks for being here.
Okay, yeah, thank you for having me. Yeah, so as Tracy mentioned, the aging plan, basically every 3 years, we create this document. And it's kind of a snapshot of what's going on in the county currently. And then we look at some of the different priorities. Each and every day and every year, we always have certain services that we're providing through the ADRC. But then above and beyond that, we can kind of focus on certain goals that we want to work on, excuse me, during this 3-year period. So actually, Tracy, if you want to move to the next slide, please. Okay, so as part of developing the aging plan, we engage in some community engagement surveys, outreach, interview questions. So for the upcoming plan, which is the 2025 to 2027, we had a community engagement survey that we sent out to our participants. We also had it online available for people in Dunn County to respond. And during that period, we received 213 responses. And then also around the same time period, I conducted phone interviews with seniors. So most of the people that I spoke with were a part of the nutrition program. So either receiving home delivered meals currently or participating in our senior dining programs. Excuse me. So I'm just going to go through some of the information that we gathered during that period, but some of the top results. So we looked at one of the questions we basically wanted to know, what are the top 3 needs or issues facing Dunn County's older adults currently? And those 3 things that kind of rose to the top when we asked that question, first was affordable housing options. Number 2 was help with home and repair and upkeep. And then home health options. So, and then Tracy, if we go to the next slide, we can kind of see. So this is a big chart, but basically when we asked that question, we tried to give the participants as many options to pick and choose from. So as you can see, there was a long list. And so beyond affordable housing and help with home repair, we have home health options, and then alternative transportation options was also up there. A couple others were just ways to keep healthy and fit, and understanding some of the Medicare and other type of government services that are available. So that was kind of the main thing that we wanted to learn initially, and it helps us understand what's going on, and then helps us kind of focus. Not all of these things are things that we can directly address through the ADRC, but it helps us kind of narrow our focus for the next 3 years. So thanks, Tracy. So also as part of the, we asked about what would they like to learn more about, because one of the things we do in ADRC is outreach opportunities, and we also work a lot with the senior center in town and a couple other locations where we can offer different activities. Some of those are evidence-based health promotion, but just in general informative types of activities that our seniors and our Dunn County residents can participate in. So when we asked our respondents what are the things they like to learn more about, healthy aging, as you can see, was kind of the top pick. And then other items include understanding government policies and also the use of technology. So those are some things that people are interested in learning more about.
Bernie, can I interrupt?
Oh, sure.
That second one was kind of puzzling to me. Understanding government and policies. Was that health related policy, or was it sort of understanding government in general? or whatever?
Kind of in general, it wasn't really specific. That kind of was the wording, just understanding government and policies. So some of the work that we do in the ADRC is advocacy related. So
Right.
actually one of our goals is related to that. So it wasn't super
Yeah,
specific on the question
okay.
side.
Okay, I just thought it was interesting. Thank you.
Yeah, yeah. Thank you. Okay, and then part of every aging plan is an important part, I would say, would be our goals. And so we get to we as ADRC develop these goals, some of the things that we'll be focusing on in the next 3 years. Now, as part of the plan, we are we have to focus on certain areas, basically through GUAR, our governing body. So we have to focus on supportive services, nutrition, evidence-based health promotion, and caregiver supports were the 4 categories for this current aging plan. And so we took the information that we received from our outreach and then also took kind of had to make these goals inside of a certain categories based on what our directive was. So our main goals for the next aging plan, the first is to provide accessible transportation for seniors living in 2 of our most isolated rural communities as part of a rural transport project during the next 3 years. One of the goals is related to nutrition, and we are working on just creating a menu for our participants that includes additional ethnic meals, excuse me, and menu items to kind of just broaden and expand our menu. We also plan to implement one additional evidence-based health promotion program in the coming year or 2. And we had some success recently with our evidence-based health promotion programs. And then we also intend to support the expansion of caregiver services by coordinating an advocacy event with family caregivers. And then finally, an kind of ongoing goal would be to continue to increase ADRC outreach efforts, which has been a main goal of Tracy's in the last year or 2 and has seen a lot of success. Any questions on any of the things I've discussed?
Supervisor Steen, go ahead, please.
Yes, Bernie, yes, is Supervisor Steen. Your second bullet point there, increase the amount of ethnic meals and menu items on the nutrition program. And I might have missed it in the report, but do you have an ethnic breakdown on our participants?
Oh, that's a good question.
And if you don't, could you get us one? I think that would.
It was in there.
Yeah, it might be in there, and if it's not, I can definitely get one from. We have a couple different databases that we can pull that information from. I know it's not a large percentage of our, and actually, I don't know. Yeah, I could find that. I think the information that was in the aging plan might have been specifically to Dunn County, not necessarily current participants in our program. But I could easily figure that out as far as our current program.
I said
Yeah.
page 13.
I appreciate that, Bernie. Thank you.
Yeah, you're welcome. Okay.
Go ahead, please, Bertie. Ready to
Thank
go.
you. And one of the last points here that I'll mention is that the aging plan, even though we are creating it now, we will be submitting it next month. It's considered a living document in that each and every year our goals and the things within the aging plan are reviewed, and they may be updated or changed as needed. But we work with we work on the plan throughout the next 3 years and make changes as needed. So that's another nice thing about this particular plan.
And
Okay.
I'll just add that I think you did a really nice job of, I mean, I think the whole report and plan is very nice, but you did a nice job of pointing out some documentation that we'd love to have you bring back to us. And I think it'll be helpful to you as the plan gets implemented. It was well done.
Well, thank you very much. I appreciate it.
So the only action items we have is just for you to vote to approve. And
Yes.
if that does happen, then Diane, I have 2 spots for you
Yes.
as the chair to.
And I assume that that was my signature, unless you need Kelly McCullough's.
No, it's actually yours. The
Okay.
Health and Human Services Board is actually considered our governing body
You
for the
did-
aging plan.
Yeah, you did,
purposes.
you did note
Yep.
that.
Yep.
All right, I'm gonna need, motion, I'm sorry, Dr. Hall.
I just have a couple of questions.
Please.
So the first one is just, there's a little bit of potential inconsistency on page 3. It says that the Dunn County Board of Supervisors is the policymaking body, and then on 31, it says it's the HHS board. So I think that's where part of Diane's question comes from. Is it her or is it Kelly?
Probably technically the same thing.
Right, so they're kind of the same thing, but I don't know if that needs to be.
I think that's easily editable just so that it's the same in both spots.
That'd be great. And then I just had a general question as someone who doesn't know a lot about this particular branch of services. So I was interested in the budget summary on page 31. And I just don't know what some of the things are. So if you wouldn't mind. So I understand federal contract expenses, right? So this is a federal funding that helps support specified projects and things. And then cash match, I'm guessing that that means that that's the county's responsibility to match a certain proportion or dollar amount. Perfect. State expenses, I'm assuming, is state grants or other support. And then I didn't understand program income expenses. I don't know what that is.
Bernie, do you want to field that or would you like me to?
Well, Tracy, if you would start, I'm actually just getting to that page right here.
Okay.
Yep.
So
Thank you.
we do receive some income because we do request donations
Mhm.
from those that participate in, for example, our nutrition services. They are donations, so they are not required. So we never turn down services for folks if they cannot meet that request, but we do actually get a very robust response to that. And so
That's
that's
great.
where the program income comes from.
Thank you. And then the in-kind match, is that also things that are in-kind, like services and support staff that are required through these programs?
That's correct. And we're able to use some other programming that's provided through the ADRC in some instances for that in-kind match.
Thank you. And then the last thing was I found it really interesting that the home delivered nutrition services are the kind of the biggest chunk of the pie, which is something that I just wasn't really aware of, right? So this is Meals on Wheels. Yeah. And
Yes.
so,
And congregate dining sites.
well, that's separate.
Yep, that is broken out,
Yeah.
and the home delivered meals is by far the larger program.
Right.
Mhm.
So
Correct.
that's just really interesting.
Maybe we should have a presentation about that.
Bernie, let's make a note.
Okay.
Taking notes.
Yeah, I'd love to learn more. It's so important. So I'd love that. Thank you.
I think we are too.
Just a point of information for Dr. Haller. It is her responsibility as the chairman of this committee, and we are the only committee in Dunn County that is self-governed, so to speak. So I thought it's just an interesting factoid. Thank you.
Any other questions, comments for either Bernie or Tracy? If not, I would love to have a motion to approve the ADRC
I so
2025 to 2028 aging plan.
I so move.
Dr. Hall moves. Is there a second? Supervisor Steen seconds. Any additional discussion? If not, all in favor, please say aye.
Aye.
Aye. Any opposed? It is approved, and I will happily sign. And then Bernie, thank you. You can go home.
Oh, thank you for your time. Appreciate it.
Bernie, this is Supervisor Steen. I'm a user of the home delivered meals. You guys do a great job, and all the drivers are very friendly and helpful. Thank you.
Thank you, Supervisor Steen. Appreciate it. Thank you.
I know that. Yep, yep.
I was gonna say that the cost of the home delivered meals, I don't eat that much. I just want to tell you that.
It's not all from you, Gary, is that
No.
what you're trying to say?
Trying to weasel out on it.
All right, thanks committee members and thanks Tracy and Bernie for all of this hard work and good luck going forward.
Thank you.
All right, Veteran Service Officer Quinn, it is up to you.
All right, good evening, everyone. I'll start the report off with the memorandum document to just identify what's going on locally at the state level, federal benefits, and then I will then move to the financial report. And I just put one small item in there just on an educational basis, just to kind of
Oh, yeah.
identify a benefit, and a couple photos, which I'm not going to go into those, but just that we're educating the tourists coming through the facility.
I thought it was a pretty cute picture, actually.
Yeah, it's always young. It's good to see the young folks interested in what goes on around here. So the first thing, we had a fundraiser that partnered a couple years in a row now with the Menominee Moose Lodge. Good partners. They make it very, very easy. Just want some of us to volunteer there to help serve the food and clean up. And they have some dedicated individuals that love to sit out around the grill and make the chicken. So it was the event was good, beautiful night. So I don't know what they have historically, because they will do those fundraisers on behalf of entities throughout the year, and so there was a lot of football being played that day. So I'm assuming that might have taken away some of the folks. And then you saw the pictures. Just a brief explanation. Answered a few questions of the young students that came through the facility. So that was nice, and I think that is it's a good community engagement. And again, it all came from county clerk and took them around a few different departments. I thought that was a nice gesture. And then Diane, thanks for signing that. I will get the letter sent off to the local 434 Pipe Fitters Union to thank them for what they had done.
Such a nice effort that is.
And they had replaced a full furnace, and they don't go into the event with that intent. They will identify a problem, and I think kind of in that partnership that they have, if they interpret that something more could be done, there's with all of the individuals involved. So they were able to get brand new furnace donated, and the technicians came back out. And usually, I'm usually telling this story, I think, every year, that there's usually one of our veterans, that gets a new furnace. And they'd contacted our office because they were in the process, because they knew they may have to trying to figure out how they were going to do it. And so they were extremely appreciative. Fixed income family, so it worked out great.
Does this happen in other counties, or is this unique to us?
It's unique in our region. So Eau Claire County is involved. I think they had, they probably had about the same number of veterans. And then you kind of look at it as the Chippewa Valley, but it's been more with us. I think they've kind of brought on some of the other parties, because you see such a great benefit and makes everybody look good with what they're doing. But as a whole, the Heats On program, I think, is national with the union members. They have refined it to veterans in our area, and it was from feedback, the technicians' appreciation that the technicians get and feel and going in those homes, that it has made it a big win.
Yeah.
For them. And they're trying to expand, up to the, I think one of their other union headquarters up around the Duluth Superior area, trying to get something going there as well. Yeah, so it's very, very good. I hope that we're going to be able to continue to do that going forward and work with them. At the state level, there isn't anything significant to report as far as any new benefits changes. There's a website change, or a veteran management system site that the state of Wisconsin has developed that has been an improvement. I know you have some of the counterparts have not liked some of it, but I think it's more because it's just change. But it is better. It is relevant. It is current, and they are making some of the glitches. They're fixing the glitches on the fly. So I think it is going to be a much better streamlined process for getting benefits approved. And it was never really bad, but we're mailing applications still, and this allows direct upload. So that's a huge improvement. The other thing is, last week I'm taking on the president's role for our association. That happened last week. Yeah, thanks. Yeah. So
Indeed.
that's so just identified a few priorities. It's like 6 executive committee meetings, couple conferences, but it's more those simple priorities. Simple priorities are to just ensure that we maintain our partnership with the Wisconsin Department of Veterans Affairs, as well as the Milwaukee VA Regional Office. They've got a director that's going to be retiring, and we've already engaged with him to try to do the handoff, because he always would come and provide about a 45-minute briefing to our association. It's good partnership with him, but again, that's going to be up to the new leadership coming in to see if they're going to value that. And so it's going to be part of that salesmanship with that. And then really the other priority is just it's training. As an association, our responsibility is to train the individuals working on benefits. There's a 16-hour continuing education requirement, and additional accreditation, and then just how to do the other nuances with the job. So that's going to be the focus and some mentorship. So I'll give you some updates. But again, you got one year, so it's small priorities and maintain.
But it's a nice recognition of your leadership, and so we congratulate you.
Thank you.
Yes, Supervisor Steen.
Yes, congratulations, Greg. We will be addressing the Wisconsin Counties Association then this year.
That would be the hope. Yeah, we have a couple of our reps that are always there. Hopefully we'll be able to. I just have to look at some of those.
I guess I was thinking specifically, is Mr. Quinn going to do it?
If we get on, yeah, we can get a few minutes. Absolutely. I know we have a table there just to provide some educational parts, because I do believe that it's important for counties, county human resources, county managers, as well as county board of supervisors understand the expectations of a service office, so that they know what they should be, what type of product they should be getting.
And if I can help grease the skids to get you on the agenda, just let me know.
Okay. All right. Thanks. At the federal level, I think I'd reported this earlier, that budgets are pretty tight. I think that's in every environment right now, and the VA, the federal VA is no different. So they've stopped overtime, where there's been a long time where they had mandatory overtime for their productivity, and there's different views. Forced overtime, does that improve output, or does it improve quality? When you have people forced to do that. So we're kind of just keeping an eye on that, because that's how we're planning for that reduction in staff hours at the VA's level is just informing individuals on the front end when we do a claim that it's going to take a little bit longer. Just expect that. So they know right away that it's probably going to take a little bit longer. And if it doesn't, then that's great. And then the contract exams, when you submit a claim, the VA uses third-party vendors, usually physician assistants, nurse practitioners that they have contracts with to conduct the examinations. And there's just not enough of them. You know, we're in an okay area because there is an examiner here in Menominee. There's one in the Durand area, and then there's also maybe one or two in Eau Claire. But then when you get into some of the specialty, like with audiology to other systems that they need to look at, they've got a small window to get these done based on their contract, and they're going to just try to find somebody. And so we've been running a situation where some veterans have been required to drive great distances, and they don't have the ability to based upon some of their challenges. So we're trying to help with that the best we can, and the best thing we can do is try to help with some of the transportation so they don't have to try to drive themselves. To the other side of it, just trying to encourage them to, hey, let's find a way to get through it.
Yeah, Supervisor Steen, go ahead, please.
Yeah, Greg, it's my understanding, and you correct me if I'm wrong, that some of these specialized medical examinations are put out and doctors or whatever kind of bid on them. So, whoever comes first might not be in your area, and so therefore the veteran might have to travel a ways. Am I understanding that correctly?
I wouldn't be able to speak 100% to that because I look at it as an organization. There's 3 organizations that they contract with, and then those medical professionals are approved and contract with one of those 3 organizations, or maybe all of them. And then I think it's just next up mentality, to try to satisfy that contractual timeline.
That was my understanding, that they queue up, and the first one that queues up, that's where you're gonna go, rather than maybe a closer one that would be further down the line. So I think I understand.
Yeah. There's one, there's one local vendor for the VA, but then the other two, I think one's in Texas, one's in California. So, it does help to have an understanding of our local area and the distance.
Yeah.
But they're just, if you're way off from another state, you don't have that investment, that personal investment in trying to ensure your individuals are taken care of. And I think the one organization does when they're dealing with some of our Wisconsin, Minnesota veterans. That's my opinion. So the other thing I just a new benefit. It's an expansion of options for to commemorate a veteran in their service with an urn or a small plaque. And actually, I was unaware it wasn't really good marketing or media until I was posed the question, and then actually it was in April, I think, that this was just brought on board. And so the VA will provide the veteran or the family has to pay for the setting if they have an upright marker that you'll see, kind of like if you've ever been up to the Minneapolis airport, you see Fort Snelling. Those are the upright, and I think those ones are marble. But you also have flat markers, which is really the way that a lot of people are going. I think it helps with that perpetual care.
My dad's.
Yeah, it's nice, but now some people do not. They're not going with the kind of the standard way of being placed in a cemetery. So you have an option now of an urn or plaque you can have and spread the ashes somewhere else. But if you opt for one of those, you don't get to dial it back and then, I want to be placed here and want this marker. Yeah. So it just offers one more. And I think it's just kind of that trend forward. And honestly, on the VA side, if you have people interested in it, these probably cost a heck of a lot less than some of the other
Right.
options. The other thing locally, I just kind of made a note for myself. This is that time of year, and I think some of my counterparts probably feeling some of that with a little bit of the kind of the as the weather changes, we've got a lot of individuals dealing with some utility disconnects, as well as some homeless prevention work going on. We have good resources and knowledgeable groups in the area to help with that, but sometimes they're complicated situations. And so we've got a couple right now where that homelessness is on the horizon, but based on how we operate, you must actually have something identifying that you are behind, or either a 5-day notice, a disconnect notice, because that helps substantiate the need. Because sometimes people are expressing a need when it's not quite there, that panic isn't there. It's not necessary yet. So we're dealing with we've got a couple right now that'll actually be putting a family in a hotel tomorrow. But he's got money coming. It's just that the check, it changed address. Sometimes people are a little bit transient, and so check went somewhere, and it takes 2 to 3 weeks to get a tracer, cancel it, and get the direct deposit set up. But that's a good problem to have, so we know that it will be resolved shortly. But we're going to help bridge that gap. I meet with them tomorrow. If there's no questions about items I went over, I will quickly go over our veterans served report, and then touch on a couple impact statements. And I think we'll be able to get a baseline really on that retroactive money, because last year was the first year that we have a full 12 months worth in this year, and we'll be over that $1 million again this year, but a couple larger claims that'll be added into this from retroactive money. So that's a good thing, and I am kind of curious myself on what that baseline will be as time goes on. But I still think it is important, because there are certain situations where it is business as usual, and that, let's say, they're a little bit easier claims that the expectation should be that they be approved right away. But then there's those ones that a lot more work goes into because of the complexity of them, that without the additional help and assistance and encouragement, the veterans wouldn't have the ability to follow through on everything. And I think those are the ones that mean the most. And those are all really kind of enmeshed in these numbers. On the impact statement, the first one is just a paragraph about building trust and in joining with the individuals that come in through our office. And it is not uncommon for us to take a year before we can convince somebody to cut that tether and let us go. We're recommending, we're encouraging, and they don't want anything to do with it. And when it comes to any type of a trauma-related situation, there's that feeling of almost re-victimization that they go through, because you have to present that information. So that trust is important. And this is a situation through working with the veteran specialists, getting a referral to work with the counselors from the La Crosse Veterans Center. And so when you make a referral, it's important that it's not just a cold referral. Try to make sure that it's a warm referral, and we're not going to send anybody anywhere we don't have trust, because then that reflects on us. And so it took a little bit of time and worked out, and then finally the individual is like, all right, I'm willing to address this now. And you look at it, it's lost years of benefit. However, you do have to be ready to address things. It's like when you you don't fold the clothes right at home. You know, take a while to address that. Just using that as an example, real life example. So the other one was, and I'll give,
Bad.
I'll give a lot of credit to the ADRC. I think we have a very good relationship, and I know adult protective services now nested underneath Health and Human Services, but it's never simple as just one of the programs. Everything's layered, and it's important to communicate and between all the parties who've been tracking this veteran who really tens of thousands of dollars due to being lonely. And then as you progress, when the financial situation is tight, then there's helpful individuals in your life to help you with that financial burden of your home and property for arguably a lot less than what you might have gotten elsewhere. So just kind of a perfect storm over quite a few years. And the internet's a remarkable place to find companionship and a lot of people that are in need of money and that will take that money from you. And that's what happened with knowingly, and that's it, knowingly, and then working with Adult Protective Services as well. We can choose to, or an individual can choose to live how they want. They can choose to give their money to anybody they want if they're fully capable. And this individual was, and you know, the best situation happened for him, and went he was able to get into Karen House right away, which was great. Able to stay connected with our office, and then it quickly was able to get to the Veterans Housing and Recovery Program, because all that stuff had been in the pipeline already in preparation, because he was trying to hold on where he was at, because you know that's what he knew. He wanted to stay there, but it was the best possible situation, and so then you have companionship with other individuals. And Veterans Housing and Recovery Program, they got 30 plus people that are there, and he'll be able to he has income. He'll be able to transition out. You know, so again, same as a Karen House, I think he was out within a month. You know, so it was good, but you know, those are more frequent than I would like. Those situations going on right now. But good outcome. He's in the right spot, and he's surrounded by programming to make sure that all of his basic needs are met. If there's no additional questions, I'll go over the financials. Just overview. There's no concerns that I would have here heading into the last quarter of the year, but I will, just for educational purpose, our office, we have three cost centers. One is for the operations, one is for our veterans relief, and the other is our grant. We receive donations, and then also we have grant money comes in from the state of Wisconsin, and then we have it's reimbursements. It's titled underneath a grant for transportation. Those numbers have went down on our reimbursement, and that's because of the VA's community care program, because people are able to get local support. But I will, underneath the operations area of the budget on the second page, just to address the parentheses, because I think that's the dead giveaway when you look at a budget, unless you're looking at the revenue part. But if you look underneath this, below, underneath the salary and fringe, and you can see that, you know, we don't budget for holiday pay, vacation pay that comes out. Just so if you look at that, we have things budgeted as if we're going to work every day. And then as any holiday pay, vacation, it shows up as a negative, because we don't have that budget, but you're not going to see the same numbers rolling out underneath the salary and the attendance hours. So I just want to let you, if you dig into that a little bit, just to address what those what that means. So there's nothing, no concern over that. And then the other part to just, we have donations. We look underneath our soldiers and sailors relief. That's where we track our donations. And so it's a little over $4,000 in donations coming in. And I forgot to address, there is we have one spot for revenue, and that's for flag sales, which we're right on track. We always usually sell about $1,500 roughly in flags. So that and then our grant, we don't anticipate. I think if you look last month, I think I've worked with our CFO and the financial manager, and they just had to move underneath our grant. We had attendance hours there listed, so those have been moved to the correct area, which was under operation. So if you compare, if you in your spare time, if you compare the last months to this month, you'll notice that changed, and I spoke to that. Any questions that you have for me regarding this?
Any questions on budget or finance for Greg? No? All right.
Two last things. November 11th, Monday, Veterans Day. So I would just ask that everyone, that Veterans Day is to honor and thank those that you are still looking at and are connected with. Memorial Day is to honor those that have left, but any gesture is a good gesture at all, because it's what the intent is. So I would just want to make note of that. And the other thing, vote.
Yep.
Gotta vote. That's like that. Everything's aligned.
Very good
Celebrate.
suggestion.
All right. I'll end.
Thank you.
Yeah, thanks.
As always, excellent. Thank you. And now we move on to the next item, which is public health. Ms. Gallagher, are you ready?
Wonderful. So you guys had my report emailed to you just a
Mhm.
couple days ago.
Yep.
Giving you guys some awareness on a couple different outbreaks that we continue to follow that have impacted Wisconsin folks. The other thing that I want to lift up is really how busy the nurses have been in this last month. So doing a lot of influenza clinics, going out to Sand Creek, Ridgeland, as well as some long-term care facilities to help get folks that want to be vaccinated for influenza vaccinated. So that's going on. And then I loved some of the photographs that were shared. It's really hard to get Carrie to take photos, so we have one of her in there. So I appreciate that. This is the third year we have partnered with a church down in Rock Falls, and we are able to work directly with some of our large farms and support Spanish-speaking folk with different access to care options for them. And so we were able to deliver a lot of vaccinations as well as communication about other opportunities that were available. So definitely starting to see that increase in use. And I think that's really positive for our families and our farms here in Dunn County. Wanted to just forecast a couple things. So next month we will bring back to you, as requested, information about fees so that you guys can take a peek at that and then give some direction. We'll want to bring that back for more discussion, and of course something that you guys pass beginning of next year.
Mhm.
And then also a report out on how the lab is doing as well. So you can expect to
Okay.
see that next month.
Okay.
Any questions on what you had?
Dr. Hall.
So I just had a question because the health department does not give COVID shots. It's not one of the things on the menu. And I'm just curious as to why that is.
Sure, great question. So we do have some COVID shots for folks that either qualify for vaccines for adults or vaccine for children. What we don't do is private pay. So for influenza, we actually purchase a substantial amount of vaccine. And then, of course, we make that money back when we administer it and then bill their insurance. We're not doing that with COVID. If that's something that you guys would like me to explore next year,
Hmm.
I'm open to it, but it's fronting the money and then assuming that you're going to get reimbursed for it. Does that make sense?
Yes. So just to clarify, it's just uncertainty as to whether it would work out financially as
You're right.
whether the demand would actually materialize.
Correct.
Thank you.
And by the way, I don't know if we all noticed, but your pumpkin nurse is extremely cute.
And the doll is a little scary. I'm not gonna lie.
The doll is a little scary.
Yeah,
Yeah.
yeah. I thought you were gonna say my sticker. So we
No.
did staff flu shots today, and so
saw
people
that.
could come down and get a sticker. Stickers always make things better, I think.
Yeah.
So we did that. So a couple things that I wanted to share with you that are not in the report. We have had, and again, honoring anonymity, we had an individual of school age that was not vaccinated, died from pertussis in the region. So definitely challenging.
Wow.
We are seeing more pertussis here in Dunn County. We have obviously not had a death. I would have shared that with you. But we're working with our physicians to understand when to test and when to treat. One of the challenges we continue to see is that providers don't necessarily think of pertussis when they think of the kind of common cold as things start until they actually see that more characteristic cough. And oftentimes that can be many days to weeks after they've been contagious. And so really trying to do some education through our networks to make sure that providers are thinking about pertussis. And then we are encouraging people to get tested and then isolate until their test comes back or 5 days after they start their antibiotics. And so that's a hard ask, but it is important to not spread that. So we are doing some significant outreach around pertussis. So I think that's important for you to have some awareness on. Another little bit of awareness is just the continued partnership with some of our educational agencies and community agencies. We are, and Chairperson, what is your title? Polly Rudy. Polly has some familiarity with. We were able to meet with all of our school nurses this week, talking through some of these things that are deeply impactful. And so I think it's just really nice to return to normal where we are connecting these amazing professionals on the regular and talking through their concerns and being able to address their concerns as well. So I just wanted to lift that up.
Great.
I just say from the school end, we're really appreciative too.
Yeah.
Good.
Good.
Great.
Anything else?
Anything else for KT? All right, go ahead.
Okay, so also in your packet, and this was actually sent out by Cassie. Thank you, Cassie. You do have the financials. You do see that there is some change as we continue to refine what we think we're going to spend out for public health ARPA dollars. And so again, continuing to the good, but trying to refine that closer and closer.
Any questions on finance or budget from the health department? All right, moving on. Anything else, KT?
No, ma'am.
Thank you. Excellent. And now it is the turn of Human Services.
Thank you.
Miss Winter.
Good. All right. So first of all, in your packet was my report. It was rather short this time, and I sat for quite a while pondering, like, what am I missing? But the fact is that it was business as normal this month, and so we didn't have a lot of new innovative things. It was just kind of doing the normal everyday work that we do. So there wasn't a whole lot. We did the United Way Day of Caring, which was really cool. We had over 30 employees in our
That's great.
department working. They did stepping stones, help paint there. They did the neighbors where they cleaned the
Flower beds.
grounds and flower
gardens.
beds and cleaned
Yeah.
up all of that. And then the rec Park, thank you. My brain is not working tonight. The rec park where they did a lot of painting and posts and different things. So that was really cool that we had that opportunity to serve the community
Yeah.
and fun day of networking or kind of working with partners. What we did this year to do that is we mixed our department up, and so they weren't in their normal teams, so they got to know other ones from other units within our department and kind of
Well done.
shake that up a little
Sure.
bit. So yeah, that was good. I put some information to share in the packet because there's a lot coming out about the seniors and, you know, the changes both in our workforce
Yeah,
and what
that's
we
interesting.
need and the aging population. So a lot there to take in and unpack, and then the information on the Department of Children and Families with the Families First webinar and all the things that they're working on there. I had an error in the fiscal section. The Women's Giving Circle is who donated the $552 for the play group, not the Women's Night Out. So I apologize for that. My error. And then I
know, right? I know.
a little bit of difference. And then I said something fun and positive and look at the pictures below, and they didn't get inserted. So I'm going to show you our fun day, and I'm going to ask Cassie and Becky to add in anything they want to, because these two did a lot of work on that day. So here is the clips from Krista Vind on our Fall Festival day.
So we had lovely weather and we got to enjoy our beautiful grounds right outside
Yep.
in the back here with trees, and it wasn't cold, it wasn't raining, it was just absolutely beautiful. The team was obviously very hungry for some fun and team building, as evidenced by how many people showed up. So that was a really great time. We had a lot of good food. We had good fun games. Cassie taught me a few things about ginormous Jenga, and she's very talented at that.
Is she?
I might note. Yes. And the highlight was definitely Judge Corpola here. She came and she selected a winning broom from a team that decorated it the best. So she was the final say. And
I
let me
wondered
tell
about
you,
the brooms in those pictures.
yeah, she can draw a crowd because that's what everybody turned up for, was the 12:30 judge time. Each team got a broom to decorate, and we could decorate however we wanted. And we had quite an assortment. So my team was pink there in the far left corner for Team Pink, because in October we wear pink. And we also had plenty of fall related broom. Anything else, Cassie, that you wanted to say?
A dessert table.
Mm.
So we had a whole table full of homemade desserts, so that was a perk. That was pretty good. And then we had some yard games too, just to kind of get everybody to kind of join and play, and there were, like, bean bags out there. We had croquet. Learned how to play that, never played that. That was fun. But yeah, it was awesome. It was super nice outside. It was we had a food truck.
I was gonna say, was that the day that the food truck came here?
And the neighbors did the baked potato bar.
I was gonna
so-
say, because I was getting a baked potato that day.
So we could have our choice. Yeah, so I chose that. So it was.
Good.
We've chosen to do that. This is the second year to do that because in the past they've done more closer to the winter holidays. And we had canceled and canceled and canceled, and people made food multiple times and never got to bring it in. So we decided instead of
snow.
because
Because
of
of the weather.
because of the weather, so we decided a fall festival would be better. So that's kind of our winter holiday substitute. So that was great fun and a lot of work by all, and giving of all, because of course that came from some people's own pockets. So that's very much appreciated as well.
And speaking of pictures related to the Day of Caring, I note that both you and Becky were participants in the.
I ended up not being able to because I had a
I saw your
priority
picture.
meeting that got rescheduled in Chippewa. So you didn't see my picture.
I'm sure, I was pretty sure I did, but hey, and Chris was
wasn't
there.
Chris was there. I was signed up to do it and then they scheduled a meeting the day before and I had no choice. So
All right. I was
I
wrong.
was not happy about that, but
Supervisor Steen.
Yes, thank you, Paula, for including this in our packet.
oh yeah.
Forward Analytics, which is an arm of the Wisconsin Counties Association, has done a lot of research on the aging of the Wisconsin workforce. And one of the conclusions that was drawn is that businesses and municipalities, if they're going to be successful, they're going to have to offer better benefits and better wages than other comparable institutions. Those are the ones that are going to be successful. And I think as a management team, you've already experienced that for retention and for attraction. So thank you for putting that in there.
You're welcome. That was
Yep.
very interesting.
Dr. Hall.
So thank you, Supervisor Steen, for kind of bringing up these materials because these are things I've been thinking about a lot, actually, with growing horror. Just in terms of the projected shortfalls for the healthcare workforce, for nursing home and assisted living beds, all those types of things. And so I had actually written on here, is the Wisconsin County Association working on this? So it's nice to hear that people are talking about at least the workforce side of things. And I found it interesting in, I think it was this report kind of going forward, or maybe no, it was this other one, the PowerPoint, right? So we've got to get people to come here who aren't here now, right? And that's statewide, and how do so I appreciated the kind of the last content slide of the PowerPoint, like how do we attract people to come, working age people to come to Wisconsin because of the changing demographics nationally. It was interesting. I looked a little while ago, and 20 years ago, the ratio of working age people to retirement age people was 3.4 to 1. Now it's 2.2 to 1. Right. So we just do not have the workforce to support the total population. And so, our neighbor to the north, Canada, is increasing immigration and making it easy for young working people to come into their country. Now, of course, at Dunn County, we're not going to necessarily change immigration policy in the United States, but
I think so.
we can make the need known, right? But then I also think about, can we attract people from other states to come to Wisconsin, right? So this last slide, our cost of living is lower than Minnesota's, but then we've got lack of sufficient housing and lack of childcare and the housing thing. And we've been talking about this, right? And I drive to Eau Claire and all the new housing units going up and all the new apartment buildings going up, right? And River Falls is doing some of the same stuff. And I just feel like our heads are in the sand because it would take a lot of work to try to get these things up and going. But I feel like if we don't, we're really in a pickle. And then, I thought it was really interesting. The last bullet point on that slide was quality schools. And our schools are suffering in this state. And, I have lots of friends that work in the school system, and I've talked to lots of folks. Schools can't hire, they can't get teachers. I have students coming into my 100 level college science courses who have basically had no science education in high school because their school kept hiring unqualified person after unqualified person, none of whom lasted more than a year, in some of these small towns. So as a state that has a budget surplus, how do we get our legislature to pay attention to this issue? And I don't know if there's a role for the counties to do that. We need more working age people, and we're going to be competing for them against everybody else in Wisconsin and everybody else in the entire country. So how do we make Wisconsin a destination for young working professionals? How do we make Wisconsin the place that they want to come to? We have the advantage for people who care about it and kind of think about it, we have the advantage that we're billed as one of the safer states to move to in terms of climate change for the next, several decades. We're not likely to, well, I don't know, we're in a drought now, but in general, we're less likely to experience some of the severe weather problems that other states are projected to experience. So there are people, literally, there are young professionals looking to move to places that they think will be more climate resilient. I feel like there's an opportunity. We have a huge need, and I just don't know how we make it part of the conversation so that the state can mobilize to do something about it. So I have no answers. I have no concrete proposals, but how do we begin to elevate this issue and maybe
And
do something?
I will say that the county is not ignoring the housing issue. I mean, that is a significant need. It affects our economic development. It affects our citizens. It affects our future growth. And so it is moving at a glacial pace. But it is being addressed. The Health Done Right Housing Action Team is working on this issue. There's a housing work group at the county moving forward. We've made an incremental change, but it's recognized. And last year, the state legislature enacted the most significant housing legislation that with dollars, real dollars attached. That's been enacted in quite a long time. So at least the housing part of this equation is not being ignored. And I think the other issues are on probably the top of the list for people who are concerned about economic development. But I know, I mean, I understand your concern. These are big issues. Supervisor Steen.
Yes, Supervisor, Member Hall, Wisconsin Counties Association has a very good management team, executive team. They're very forward thinking. And what they're trying to do is get into the digital world, so to speak. And they're going to, part of their thrust, and I'll see if I can't get our chairman to come up and talk, is to form their own studio, so to speak. They're lobbying very hard with the legislature, and they have to be nonpartisan, because whoever wins the election, they got to work with them, try to further the county needs. And they're working hard to build the trust so that the legislators come to them for answers. And then also they're in the process of setting up a video thing and news. I guess creating our own news, so to speak, giving the legislators a place to get the message out. And so they're working on that. It's a work in progress, and it's a change. It's a change in all this analytical stuff and everything they do. They're sharp on that, but you present it to the county boards, well, they got to do something with it. And then also the information, valuable though it is, has to go to the legislature, and that's where the action has to happen to make things change and what you're talking about. So I'm excited about it. It's a different way of looking at things, and trying. The whole thing is designed to be more effective, to get to where we need to be. So I hope that, and I'll talk to the higher ups in the WCA and see if I'm sure I could get them to come and give a presentation to the county board. So.
Can I add?
Yes,
I
please.
was at the Human Service Directors meeting last Friday, and a neighboring county in our region was talking about their nursing home working to bring immigrants in to work at the nursing home and to increase that field. And there's some challenges, of course, that comes with that, language barriers or housing and all of those kinds of things. So really thinking strategically how to do that, how to create a community for them, and be able to get them to the food and basic. I mean, there's a lot that goes into that, but they're really looking at that as being a strong possibility to help support that need of the nursing home, which is quite large. So I think there is some looking at some of those things, and I don't know where Dunn County sits in some of that, but it might be some opportunity to look at some neighbors and see what they're doing as well.
And I've had a couple of conversations with Carmen at the Neighbors of Dunn County, and I mean, this is certainly something that's being discussed. I mean, there are huge staffing needs at the Neighbors, so.
Yeah.
All right,
Thank you for
anything
bringing that.
else? Go ahead.
Okay. Then my next report is the financials. And that was included in your packet. That was a significant decrease from last month. And so when Jerry showed Becky and I this, I went, what? And she said, Paula, what I did is review the WIMCAR, which is the settlement that we get
Right.
each year. And she said, based on some history, she said, I felt like we were overstated in that for as much revenue as we would be getting. So she said, I think this is a much more realistic number.
Okay.
So that reduced quite a bit. And then we did receive quite a bit of children's waivers money last month, and that kind of put things off in the percentage. So she changed some of those variables as well, stating, I think this is much more realistic as what we will get in revenue. So even though it's a huge decrease,
difference.
she said, I believe this is more realistic as to what we really will come in with. So
Okay,
those were the two significant changes that she made in here with that. So
Supervisor Steen?
What are we coming in with?
653.
53.
Yeah.
653, 983 to the good
Yeah.
is the
But thank you for
projection.
your vigilance, and it doesn't do us any good.
Microphone.
Excuse me. Thank you for your vigilance, and it doesn't do us any good to ponder over numbers that aren't accurate.
Exactly.
You'd rather fudge a little bit on the low side so that you're looking better in the end. So
Right.
thank you.
Right.
Yeah.
Right.
And I think every member of this committee understands how unpredictable
It goes up and down.
the human services budget is. This is, it's sort of crazy budgeting, but you've done a really nice job with this and it looks good.
Thank you. There will be some changes. My understanding that is that Jerry now will be moving to a pit lead on the ERP
Okay.
process, which will take much more of her time, which is supposed to be 100% DHS financials. And so Beata is going to be taking over this report. So
Okay.
that will be an interesting to see
That's
if
an
there's any
interesting choice.
differences in that. But that was the news I heard yesterday. So if that's accurate and moves forward, that she'll be completing the report, but I don't have any concerns with her doing that. I think obviously she'll do a great job with it. So
Yeah, Supervisor Steen.
She's going to complete the report and present it, or are you going to present it?
I'll present it.
Thank you.
Never mind. Never mind.
That's all
All
I
right.
have. unless
Anything
you have a
else?
question.
Anything else? Any questions for Paula? All right. One last, we have a budget adjustment. The group behavioral health, ADRC. Any questions about this before I ask for a motion? All right, I need a motion to approve the budget adjustment. Supervisor Steen moves. Is there a second? Supervisor Breslin seconds. Any additional discussion? If not, all in favor? Aye.
Hi.
Any opposed? Budget adjustment passes. And are there announcements? If not, without objection, we are adjourned. 2 months in a row, adjourned early. Well done.